Hi everyone, welcome to our YouTube channel. Today we're going to talk about opioids and the fact that they are the worst drug to be addicted to. The success rates are so much worse than alcohol or cocaine or amphetamines or other drugs. And so I want to talk about why that is and what we can do about it. This YouTube channel is coming out once a week to give you up-to-date information that's medically based and evidence-based, but also combined with over 35 years of practical experience treating patients with the disease of addiction. So if you like this content, please subscribe and tell your friends and keep coming back for more shows. So we've known for a long time that the success rate with opioids is much lower than other drugs. In fact, generally speaking, we think of a 28-day program as having 60 to 70% success rates with alcohol. But when we look at people coming out of a 28-day program who are addicted to heroin or oxycodone or any of the other opioids, the success rates are much lower, probably in the 5 to 10% range. I remember a study that came out of Seattle, Washington quite a while ago, and they put about 130 people in a detox program and detoxed them and then had them go to treatment after that. And after 3 months, only 4 of that 130 patients, actually 5 of that 130 patients were still off opioids after only 3 months. And way back in 1990, I was working in an outpatient program where we treated alcohol and heroin addicts. And our success rate for the alcohol patients was around 60 to 70%, but we never had one patient who was addicted to opioids who even completed the program. So we know that that's the way it is, and we need to deal with it. In fact, a lot of inpatient programs like Betty Ford Center and Hazleton and other good inpatient programs are now putting people on some form of medication-assisted treatment, even Suboxone, that they would have never done 10 or 15 years ago because they recognized that so many people relapsed. And when they relapse after a period of 28 days or more off opioids, then fatalities can be quite high because people have lost their tolerance. So let's talk about the different drugs and how they work and how opioids work and why opioids are just so much more difficult to recover from, and then what we can do about it. So opioids obviously work on the endorphin receptor in the brain, so we all know that. So our brain has an endorphin receptor, and the endorphins and the heroin or the opioids come on and turn that receptor on. Why do we have endorphin receptors? Because they're our natural painkillers. Endorphins actually means endo, from within, and orphine or morphine, so it's really morphine from within. And so our brain has these systems to give us pain relief, but also to give us energy. And so when heroin or other drugs come along and turn that switch on much stronger than it was meant to be turned on, people feel fabulous. They have a lot of energy, they have a lot of pain relief, both physical pain and emotional pain, and they get the dopamine effect where they get a dopamine spike, so they get a lot of euphoria. So it feels incredibly good, and that's how that drug works. All addictive drugs also release dopamine in the pleasure center, but they also have some different effects in different parts of the brain. So alcohol, cocaine, amphetamines, even marijuana, all release dopamine in the reward system in the nucleus accumbens, and that's what makes them addictive. But each of the drugs has some slightly different effects. So alcohol, for instance, releases dopamine in that pleasure center, but in order to do that, people have to drink quite a lot of alcohol, and alcohol affects all the other parts of the brain and the body as well, so that by the time you've drank enough alcohol to get a good buzz going, you're also slurring your words, you wake up with a horrible hangover, you often make a fool of yourself, your emotions get really out of whack, you often have a bit of a stomach ache, you can get stomach ulcers, you can get brain damage, and so there's a lot of side effects because that's not really what the patient wants, what the person wants when they're drinking alcohol. The other drugs have a lot of side effects as well. Cocaine goes straight to the pleasure center and releases dopamine, but it has lots of side effects too in terms of giving you energy, but then a really big crash. Amphetamines and other stimulants like that do the same thing. So why Are opioids then worse than the others, and why do we see relapse rates so much higher and recovery rates higher? Well, there's a number of reasons. The first is that the dopamine effect that you get from the opioids is very strong. People really like it. They get a high from it, and it's just an incredible feeling. A patient of mine actually a while back said it's like getting a hug from God. It's just such a strong feeling. It's such a pleasurable feeling that it becomes very tempting to use again, even if you haven't used for a long time. So relapses can happen. Second thing is that the memories that get laid down because of that intense dopamine are also very, very strong, and they're very long lasting. So people will remember that feeling and that effect for a long time after they've stopped using, months, years. I heard of a doctor recently who had been in a recovery program and had been followed by the Board of Medicine out in California, and he'd been 5 years clean. But as soon as his monitoring was over, he relapsed almost immediately because that memory circuit was so strong that he just wanted that feeling again. So that certainly leads to an awful lot of cravings and relapse. The opioids also give you incredibly good pain relief, both physical pain but also emotional pain. And so, of course, when, life is full of emotional pain, we have all sorts of emotions like anger or sadness or loneliness or boredom, any of these emotions, and opioids just cover that up pretty nicely. In fact, Homer, the poet that wrote the Odyssey, actually in that poem he says opium, or the opioids he was talking about, is the drug that lulls every sorrow. So even back 600 years BC, they knew that the opioids lulled every sorrow. So it's such a strong effect, and life is full of ups and downs, and so it's very tempting for people to use again. If they've been clean for a while, it's very easy for them to relapse. One of the main reasons that people relapse, I believe, is because opioids have very low side effects. So the opioids go straight to that endorphin receptor, and then that goes on to the pleasure center, the reward system, and there's really not much side effect that goes on. Yes, there's some constipation and your pupils get small and things like that, but in terms of toxicity, it's not particularly high, and so it's fairly easy to cover that up. In fact, a patient I just saw last week, he's been clean and sober since 2005. I'll never forget, he worked at a factory here in town, and he had an addiction for about 15 years that his wife had no idea about. He was using IV heroin every morning and every night, and she had no idea that he was doing it. He was able to keep that to himself because he didn't look intoxicated, he didn't look bad. So I sort of tell patients that opioids are kind of like a rifle shot that goes straight to the pleasure center and turns the switch on without a lot of peripheral damage. Alcohol, on the other hand, is kind of like a shotgun. It goes to the pleasure center, but you feel pretty horrible. Where that comes into play is when it's time to stop. Alcoholics frequently know they feel horrible and they really kind of want to stop. They have trouble stopping, of sure, but they know that there are a lot of side effects. And for some people, it's just a huge relief to actually get into recovery and even get forced into treatment. A friend of mine was actually stopped by the cops, and he knew he had a bad alcohol problem, and he said his overwhelming feeling was that he was just so grateful that the chaos and the madness was over, because he wanted to stop, but he couldn't, and then it just took that legal sort of thing to push him over the edge. But opioid addicts, they actually feel pretty good. We see chronic pain patients who come to the doctor and use these opioids every day, and as long as the doctor keeps prescribing it to them, they're pretty happy to stay on them. So the way that translates is that when they're in recovery for a while, their memories are there of how good they felt. They don't have a lot of memories of how bad they felt when they were on it, so it becomes a lot more tempting for them to use again. And unfortunately, one of the other effects of opioids is that tolerance builds up so quickly, so if they use even once, they're usually back using regularly every day, and within just a week or two, they're back physically dependent. So in addition to opioids being kind of the worst in terms of relapse rates, they're also the worst in terms of their toxicity. They're the most dangerous. Why is that? Well, opioids go to the breathing part of the brain and slow it down, and at higher doses actually stop your breathing. That's how almost everybody dies of an overdose. So other drugs don't do that nearly to the same extent. So the toxicity and the fatalness of the opioids is very, very strong. And what's worse is that is additive with other drugs. So if people combine their opioids with any of the benzodiazepines like Valium or Xanax or even alcohol, then overdoses are very, very common. Tolerance builds up really quickly. So what starts off as maybe just a $10 a day habit very quickly builds up to $100 a day. Most of the patients who come in to see us have about $100 a day habit. Some of the newer drugs like fentanyl are much more potent, and the overdose potential is much higher because the amount of drug that actually is fatal is incredibly tiny. But even with heroin, the amount of drug that people need that is a fatal overdose is very, very low. Another reason why they're so dangerous is there's a low therapeutic threshold. And what we mean by that is in medicine we measure a therapeutic threshold, meaning the difference between the dose that is effective and the dose that is fatal. So with a drug like penicillin, for instance, it has a very high threshold. That is, the normal dose of maybe 250 milligrams of amoxicillin, you could probably take 100 pills or 1,000 pills and it wouldn't kill you. But when it comes to opioids, the difference between the dose that gives you an effect and the dose that kills you is actually very narrow, so it's easy to make mistakes. As you can see, opioids have a high relapse rate and they are much more dangerous, especially in terms of fatal overdoses. And we see that reflected in the numbers of over 100 people dying every day of opioid overdose. So what can we do? Well, the first thing is we can accept that that's the reality, and we can help people get into treatment as quickly as possible. We need to make treatment as accessible as possible, and we need to encourage people to get into treatment as quickly as possible. We know that treatment without medication-assisted treatment is usually not very successful, and therefore we strongly encourage people to get onto one of the forms of medication-assisted treatment. That includes methadone, Suboxone, or Naltrexone. They each have their place, and I'll talk about those in another video, but the importance is to get on one of them so that you stop using street drugs, especially now that fentanyl is out there and it's so potent. People who have opioid problems need to essentially work their program a lot harder than other people. There's just less of a safety margin, if you will, for slipping up. So people have to really participate in their therapy. They have to really engage with support groups. A lot of people are finding that living in a structured living environment like a halfway house is incredibly helpful because it minimizes their triggers and allows them to have support and deal with their emotions with other friends and colleagues in the program. So essentially, patients with an opioid problem really need to take their program seriously. They need to avoid using other chemicals like alcohol so that they're not triggering themselves. And if they do those things and they really concentrate and they really take advantage of all the treatments that are out there, then certainly people can be very, very successful. Thank you. So if you've found this information helpful, please subscribe to our YouTube channel, or you can email me at drcoleman@thecolemaninstitute.com. I welcome any questions or suggestions for further programs if you have any issues you'd like to bring up and to be answered. Please also share this video with friends and family if you find it helpful.